Hello. Hi, Shalaka. Good
Hi
evening,
Nilima.
everybody, and welcome to this evening's conversation about adolescent sexual health and the teen connection with Dr. Shalaka Shimpi. She's a dear friend of mine, and we had a fabulous time in Bhutan. When I was there, we went traveling. But she's a very eminent consultant gynecologist based out of Pune, working in the center of Pune in Deccan Gymkhana for over 25 years. She is an avid blogger, and her posts on social media are followed by thousands of women and adolescents as well. And she has recently received an award from none other than Swapnil Joshi, a very famous Marathi actor, for her contribution to medical literature via her social media posts and blogs. So, welcome, Shalaka. It is such a pleasure to have you here after such a long time. And we've been planning this and planning this, and finally it's happened. Yes,
Since
I'm
ages,
so
we are
excited.
planning since ages, and finally we are here.
So, Shalaga, what else are you involved in right now? I know you are very active and you're doing lots and lots of stuff with, corporates and many other endeavors. Can you tell the audience a little bit about all the different things that you're involved in right now?
Yeah, I first of all, Nilima, thank you for such a lovely invite and such a lovely. It's truly humbling to hear so many words of praise from you, from a person like you who herself is immensely
Very
talented.
dear friend. You're my sister from another.
Okay, thanks a lot. So I'll give a brief introduction about myself. I'm Dr. Shalaka Shimpi, practicing in Pune for the last 25 years now. I have a keen interest in adolescent sexual health. So this topic is very dear to my heart. Presently, I'm attached to Jahangir and Cloud9 group of hospitals, and I have my private clinic in Deccan. I also do a lot of corporate workshops, seeing the stresses of urban life, what women face today. So I have decided to do quite a lot of corporate workshops. I am an active Rotarian, and though I don't very frequently go for their weekly meets, but I do make it a point. I do one health program. I do one major health program per year. In that, we cover a lot of rural sectors, and we take lectures regarding menstrual hygiene, adolescent girls, and this from basically from the lower strata of society who don't have access to a lot of medical care. Recently, I also visited Central Jail in Yeroda, and I gave a talk about, actually it was more of an interaction with all the inmates who were serving a death penalty and sentence. So that itself was a very big eye opener for myself. I was very disturbed after taking that lecture, because it's a totally different world out there.
Yes.
So you can't even imagine. So that was a very actually very difficult experience, and it became a changing point in my life. I also now, since the last 3 or 4 years, I have been actively writing, and I have put up a write-ups on social media. This is basically to create awareness, because as I was into practice, I realized there are a lot of myths, misconceptions. Actually, when social media came, along with it came WhatsApp University, and lots of misconceptions. So I said it is high time that some we give some scientific guidelines, or we actually tell people about myths and facts about. So then I started writing about this, and then slowly, as the audience interaction increased, and people started liking my posts, and actually, I found out it was quite helpful for them. And when you actually start interacting with them, you come to know that very basic facts also women don't know, or
Yes.
there are lots of myths and misconceptions. So then I started carrying it forward, and I now actively write. I have my own Facebook page, because I thought, rather than sharing in my wall, I developed a Facebook page basically for medical write-ups, and that is how I got selected for this award.
Excellent.
So that's about it. So I think we'll have a nice talk today
Yes.
about sexual health, because I think this is a topic which needs to be addressed.
Yes,
Uh,
we have
it's
we
very
have
important.
we don't just have some parents attending, but we also have parents who've asked their daughters or sons to attend.
Oh,
So
that's great.
That's
Great, great.
great. Right? And
Yeah.
even if they share it, parents, if you'd like to share this video with your children afterwards, please feel free to do
Yes.
so. Shalaka is a mom of two teenagers, so she knows very well what it's like to interact with two totally smart and tech savvy kids, which is the case with many of our
Yes,
ladies
yes.
now, because we're
So
of that
some
age.
things I have learned from my children also.
Yes, 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 yes. So, my first question is about COVID. Obviously, we are still in COVID, and now lockdown has come again. And all of last year, kids were stuck at home, teenagers.
Correct.
And what kind of health problems have teenagers faced during this lockdown period? And what have parents been doing to cope with, this kind of digitized lockdown? Because the only outlet for these teenagers was their computers or mobile phones, and that usage must have gone up tremendously. How has it
Tremendously,
affected their
tremendously.
health? How has it
Uh,
affected their health?
I can tell from my own personal experience also of what my friends with their teenagers, they all. So initially, what happened, Nilima, when the lockdown started last year, about the same time, I
Yeah,
guess.
yeah.
So most of the IT people and most working parents suddenly they were given the option of work from home, and everybody stayed home, and then everybody was under one roof. Children since their birth, I don't think they were used to such kind of, because they were so busy with their classes and school and sports activities and all. Suddenly every life just came to a standstill. So initial 2 or 3 months, I think most of us enjoyed.
Hmm.
Not us, I won't say, except doctors and except the frontline and the healthcare workers. Most of the families had a very good quality time together.
Hmm. Hmm.
And they started, because I remember in the month of April and May, suddenly all maids also disappeared. So
Yes.
then actually, then suddenly I think the trend started of home cooking, and we had dalgona coffee and everything, suddenly cakes, pastries, everything started. So this initial 3 or 4 months, I think everybody took it very quite easy, because we never knew what we were in for. We thought about 6 months, 8 months, and we'll be out of it. But so initially, the whole time went on just cooking and eating, no physical activity at all. What happened after about, I think about 5 6 months, everybody got bored, because see, we are not used to this stuff. Your kids are not used to being, they were just actually caught up in the house with mobiles and their laptops. Initially they were very happy because parents were busy with their own laptops and children were busy with their own phones. But after about 5 6 months, they all got quite tired of it, and they suddenly had that feeling of getting locked down, literally locked down in their own homes. And as our practice continued, like, I remember since COVID, not even a single day I was home. My clinic was on, hospitals were on. We did reduce a little bit of elective surgeries, but otherwise OB-GYN work continued.
Hmm.
So we were available for on-call consultations also. So what happened about in July, August, suddenly I have found that the incidence of PCOS has gone up, because the children, adolescent girls started putting weight. Their lifestyle suddenly changed.
Hmm.
They must have been under tremendous stress. See, children can't express their stress, but
Hmm.
obviously it was stressful for them because they were never used to this kind of lifestyle. So the incidence of PCOS definitely went up, and the obesity went up. Childhood obesity also went up, because I have had patients who came to me in October and November, or who come now and who have put up to 10 kgs in the last year. So they have started gradually putting, and see, when you are gradually putting on weight and when you are seeing that person every day, you don't realize.
Hmm.
So unless somebody else sees you, now we are all in lockdown, so nobody else sees us basically.
Yeah.
So these children have started putting on weight. They started getting PCOS problems, so they had irregular periods. There was another flip side to it, because they started having their own WhatsApp groups.
Yeah.
And so what happened? I think the parents were busy on their laptops. They were busy with their official work. Children were busy on their phones, because most of them who even didn't have a phone before got a phone or got an
Hmm.
Android in the lockdown. And uh, I want to stress on this part, that though as parents we know and we trust our children that they will be doing their homework or whatever project work on WhatsApp, we have to keep an eye that WhatsApp is not only for schoolwork. There may be other forwards also which they must be getting on forwards. Children
Hmm.
today are very smart. They can delete their search history. So Yeah, so you have to keep that in mind. So there's no point in searching their search history, because the minute they see it, they delete everything. So I think the best idea is to have an open communication about them, and to accept it. As growing adolescent children, they are going to do it. If they don't do it, I think it is kind of unnatural. If your 16 17-year old is has not seen anything, or not even forwarded any jokes or anything, then I think is a real time maybe you should start worrying. You should give them some uh, uh, leverage. And I think, but this also has definitely increased. The use
Right.
of pornography has definitely gone up in lockdown,
Yes.
including everybody, including
Adults.
men, including women, and including children.
Right. Right.
So I think
And,
a good idea is to basically monitor. What you
mhm,
can do is, when they have a lot of WhatsApp group, what we do, because they have a lot, children have their WhatsApp groups, school WhatsApp
mhm,
groups.
mhm,
So
mhm.
ideally, I think one or two adults should be in their WhatsApp groups,
Yes. Yes.
just to keep an eye.
Monitors.
And as we do it in our home, whenever children are on their laptop, or whenever they are using the net, we tell them to use it, sit in the living room and use it. So
Hmm.
they're not supposed to go into the bedroom, lock the door, and use
Door.
the net.
Right.
So
Right.
even if we are not there, when they are in the living room, they are under a little bit of radar.
Yes.
So that is how I do about it. See, everybody's way of setting boundaries is different, but I think
Different.
that is a very important thing. So this changed, I have definitely seen in lockdown.
Yes. And um, you talked a little bit about pornography, but maybe there are some other sexual health concerns that have also become worse. Maybe you've been around, like you've been in Deccan area for over 25 years. How has the trend for sexual health concerns changed in the last maybe 10, 15 years?
Yeah, see, now I've been practicing for quite some time, and I have seen this change in my practice in the last, see, about when we started our practice, this problem was never there. It was there, it was not so common. So
Pornography.
nowadays,
You
today,
mean pornography or
yeah, pornography and the sexual debut has also come down, definitely.
okay?
Because
So
when I started my
they're having sex
practice,
longer at a younger and younger age.
correct, correct. So that is
Right.
the age at which the first sexual debut or the first sexual intercourse happens has definitely come down,
Right.
especially in urban cities. So actually, when I started my practice, we used to have women as old as maybe 24, 25, and a little group, and maybe a small portion of unmarried girls who were sexually active. Today, I find a majority of unmarried girls, say, I would say in my area, it's about maybe 60, 70%.
That,
So
wow, that's
unmarried
so
girls
interesting.
from who are sexually active right from the age of 17 to 24. And I think the
Wow.
17 to 21, 22 is a group where we should be very concerned, because they are still young,
Yes.
still yeah, they don't know contraception, or they are aware of many things, but that doesn't mean they know the exact truth
Yeah.
behind it.
There's a lot of myths,
Correct,
misconceptions,
correct. There are a
and
lot of
ideas.
there are a lot of myths
They have a
with
mobile
this age
phone,
group.
but it's just like a information feed that they don't know how to get the best out of.
Yes, see, because basically what happens in, especially in this age group, the amount of information or the source of information they get is from their peers,
Yes.
or from their elder sister or elder brother of their friend. So that is
Hmm.
the only source, or the net. So these are the only two sources. So what one way we can do is start talking to our children,
Hmm.
and start talking them at a very young age.
Yes.
What you can do is, especially if I think children are with this topic, most of the children are comfortable with their mothers. So
Hmm.
you can still start talking mothers or even aunts. Sometimes an aunt is more approachable than a mother
Yes.
directly.
Yes. Yes.
So
Yes.
so because I have a niece, so I know that. So
Hmm.
I think you can start talking to them. If you are not comfortable, you should take professional help. There are
Yes.
lots of gynecologists, or you can go to your pediatrician, and
Yes.
get them. They should get source from the right information. That is very important. And I would like to stress on one point: no amount of information is too much for the child. So
Hmm.
what because I have seen many of my patients, especially mothers, who feel that no, still my child is very young, I don't want to start on this topic. I tell them, she only might tell us two or three facts which
Tips.
we don't know. They know so much more now. So you have to accept it. and start telling them basically and start a dialogue. That is very important.
I said there are many stories where mothers will tell you, they're getting ready or something and they get a tip from their teenage daughter, Mama, you don't look sexy when you do that. I know
Correct,
our
correct.
mother because daughter is only 5, but she gives her tips like this,
Yeah,
Mama.
because I have freaked out a lot many times because of my daughter like that. Yeah, so that
Great,
is there.
great.
The dialogue, opening the dialogue and communication is very important. That should start at a very young age, I feel. So
Yeah.
that
And
makes them comfortable. See, you should not treat sex as something which is unnatural and it's as a taboo. You should be
so
very
these
open to
teenagers,
discuss.
you do a lot of training for adolescent sexual health in schools
Yes,
as well. So in
yes.
your experience, how aware are these kids about sex, masturbation, pornography, about what is virginity, what periods or menstrual problems, hygiene? How aware are these kids of these topics when you address them, and do they are they open enough to ask questions? What kind of questions do you get?
Yeah, see, I like to say one thing. We had by the Foxy had started a very nice program some time back, Teach Them Young, Catch Them Young,
Yeah,
in which
because
we used to.
Maharashtra government
Government
hasn't
doesn't allow.
taken them
Government
on.
doesn't allow because we also privately also we tried to approach a lot of schools. I tried to approach a lot of institutions, saying it we are ready to do it. We are ready to do it free of cost.
Yes.
So I know one or two reputed institutes from Pune. Their principal told me, no, 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 this is too much. Our children are not into this, and we don't want you to come and give them any extra information. Then I
But
had to tell her. I said,
only
madam.
educating people will make them sexually active.
Correct. So I told them, Madam, I can give a list of girls from your institution who have come and done abortion in my clinic.
Awesome.
So, so that is why we need to teach them about contraception. So,
Yes.
because if they don't know, they will land up into problems. So, we are not going to give them anything which they don't know, but maybe we can protect them from harm.
Yes.
So that is why then they incorporated me into their medical cell. What I do is basically when I take a lecture, I make it very clear I don't want any of the staff inside.
Hmm.
So I tell the principal because children are not going to stand up and ask in front of their teachers.
No.
And
Yes.
what I do, I normally tell, I take a lecture and then we take a question answer session at the end. And then I tell them to write down their questions and then I answer one by one, anonymous questions. We tell them, give them chits and just make them pass. And you will be amazed the type of questions they ask. Children from 5th and 6th standard ask about oral sex, anal
Wow.
sex, tampons. So
Wow.
this so after the lecture, when I go and tell their faculty, see this, and we have to clear these concept for them, and
Yes.
only we can do it. Otherwise, they will be in big trouble.
Yes.
So that is how about it. Virginity and all, I think it still matters in some part of the society because we have a lot of we have I won't say lot, but we have quite a few girls who come for hymenoplasty now.
Yes.
So
Yes.
they come
That was
on
my
their
concern.
own.
That was my
Yeah,
concern. That
so that means they are sexually active, and when they are about to get married, they want their hymen soon back.
yes.
Yeah, so that is still because that is still considered a sign of purity.
Yes.
We
Yes.
tend to talk them out, but
Yes.
they say no, our families will not agree. Sometimes the boys have told them that whatever you do before marriage is none of my concern, but I want the hymen intact. I want to bleed. I want you to bleed during the first time. So they are
Yes.
under tremendous pressure.
Yes.
And so I feel basically it's they need a lot of counseling, and for this I think we need the society to change because
And
I
do
don't
the
think.
other staff, I mean, now with this is just a different angle, of course, and you may choose not to address it because it may take us off the line, off the topic. But with POXO also, are the faculty aware of POXO and that they have a responsibility to protect these adolescents? And if they come to know of sexual activity, they're supposed to report it. Are staff aware of POXO?
Staff as we are making them aware because I had 2 3 incidences in my clinic and I've come from a background except me all are lawyers in my family, so I have that background in my family, so everybody keeps on scaring me every time. So okay, you have to do this, you have to do that. I had two, three incidences in my clinic when I had a patient who was, I had a young girl who was sexually molested. She met that guy on Instagram 10 days back, and
Wow.
she landed up, she was deaf and dumb, and she landed up in a lodge with him within 10 days.
Oh
And
goodness.
she had a lot of bruising and a lot of bite marks. And her sister came to know, and her sister was my patient. She was a patient of PCOS, so her sister got her to me. When she came, first thing is I asked her age, and when she told me she was 15, we had to report it to Costco, because
Yeah.
then cannot examine, because if I examine it, implies to tampering with the evidence. So then
Mm.
unfortunately I had to send her to our government hospital, saying this is a private setup and I won't be able to interfere in this. This has to be reported to police and all. But what happens, patients do get scared, women will definitely get scared, and they don't want to, then the police and all, to interfere. But yes, we have to be extremely careful. Guidelines are extremely strict, and we will have to follow them. So
Yeah.
nowadays what we do, we see any young girls or young women, we take their I card, Aadhaar card, and we check for their age proof, and if
Yes.
they're above 18, then only we take them, because
Yes.
otherwise we are not allowed to examine.
Not allowed. Yeah. So you mentioned this patient of yours who has polycystic ovaries. Just moving
Mhm.
slightly away from like sexual health, and we'll come back to it later on as well. But there are a lot of young girls have very serious period problems, and with this kind of lots of fast food and obesity, the age of first menarche, the
Yes,
first period
yes,
has
period.
gone down quite
Definitely.
a lot.
Yes,
So
definitely.
a lot of
Definitely.
heavy periods,
Yes,
anemia, and polycystic ovaries. So,
yes.
can you narrate some cases from your practice which can help the audience and especially parents to identify these risk factors in their daughters, and that they should actually take their daughters to a gynecologist?
Yes.
Can you just highlight some of these concerns that we as gynecologists have about young girls and their period problems?
Yes, what I would like to say is PCOD is definitely, it's a new menace on the horizon, because today I think almost every third or fourth patient I see is of a PCOS. And that is why I run a PCOD clinic also, where we cater only to PCOS, specifically diagnosed PCOS patients on a particular day of the week. And believe me, it is running full. So that is basically, I have seen that it is a disease of the urban population more so, because it is a lifestyle disease. And
Hmm.
so actually I think all parents should be vigilant whether their daughter is getting her regular period every month, or say every 6 weeks, and she's not putting on unnecessarily weight, and she leads a very active life. Basically, physically she has to be active. All girls usually, normally what happens, these PCOS girls, this starts in maybe say 14 or 16 years of age, and they are usually in their 8, 9, 10 standard, and they
Hmm.
are very busy with their schooling and with their classes. So
Yes.
the parents say, नहीं नहीं, उसको तो टाइम ही नहीं है अभी पढ़ाई करने, एक्सरसाइज करने के लिए, वो तो पढ़ती रहती है बस दिन भर. शी इज आइदर इन फ्रंट ऑफ द लैपटॉप, और शी इज स्टडिंग एंड विद अ प्लेट इन हर हैंड एंड
Yeah.
ईटिंग समथिंग. एंड अभी तो बिल्कुल टाइम ही नहीं है, वो सब कॉलेज वॉलेज में देखेंगे. सो आई टेल देम, सीट, यू हैव, शी हैज 24 hours. 1 hour of physical exercise is not going to make any difference in her academic grades. What you
Hmm.
can do, if she doesn't have time, or she really can't go out, then just tell her to climb the stairs, climb up and down, do some skipping. It hardly takes, what, 20-30 minutes to do that. Or simple things like you stop using the remote, and every time the bell rings you go, or every time you get tell her to get some, do some grocery shopping or something. Basically you should be active. Second thing,
No,
you should
no
cut down on.
Coca-Cola, no bakery
Ah,
products.
and see what happens is basically, I think in everybody, not only in the Indian subcontinent, but everybody, we tend to associate any celebration with food.
Food,
So
yeah.
अच्छे मार्क्स मिल गए, कोक एंड पिज्जा का पार्टी, केक काटो. सी, एनी गुड न्यूज इन द फैमिली, एनीथिंग, यू ईट स्वीट, कुछ मीठा बनाओ या कुछ. So I always tell कि if you want to celebrate, go on a small trek or go cycling together. So that is a good thing. So that parents, I think we have to inculcate those habits in our children.
So your kids are into music, they do a lot of
Yeah, my
music and
kids are into
jamming.
music. So we have a jamming room. My husband and kids are into music. So that is how they basically they take care of their free time. And so you can do that. They can read, or they can just go for cycling, or they can they half of the times they are playing with the dog, or they're playing football downstairs. So that, and I don't think that an hour or so it actually affects their grades.
I know you were saying that we, especially in India, we give a disproportionate amount of importance to grades and marks. And I want you to comment a little bit about the holistic attitude towards teenage health. Because um, how can parents inculcate good habits in their teenagers? Because sleeping on time, eating the right food, exercising properly, making sure that they have some sort of practice that centers them, that allows them to engage in social contribution, maybe build relationships properly, understand, learn a little bit, study something with a purpose. These kind of things kind of get missed because they're so focused on grades. Can you talk a little
Correct.
bit about
Yeah.
what parents can do to improve this?
The parents can definitely do. What I personally feel is, instead of just preaching, because it's preaching is like just radio mirchi in the background, it doesn't work. So instead,
You
it's
know.
yeah, they'll turn off. They'll turn off. They'll eject the CD cassette and throw it away. So instead of doing that, what I think is, basically you should demonstrate. If you wake up early, you are physically active, you are eating the right grains. See, you can't, you while you are hogging on a pizza, you can't expect your children to have green vegetables. So,
Yeah.
but in our house we make it a point to eat bhakri and vegetable in the night. So so you either, so it's like you eat that and go to sleep, or you sleep hungry. There are only two options. So they eat. So, and that you have to start these habits right very early, because it's very difficult. The later you start, the more difficult it gets.
Mhm.
And as people always ask us, both of you are doctors, so your kids are going to be. So no, I said no. Both of my kids have very early in life decided whatever they want to do. They have not decided, but they have decided they don't want to become doctors. So
Right.
then we are perfectly fine with it. I always tell, whatever you want to do, you do, but you should be happy and you should be good at it.
Mm.
Do it passionately. Then you will then you will be happy if you do what you like to do. And third thing is, I think parenting is always, I there are three types of parents. You either become a permissive parent, is you allow everything and anything under the sun, and they will start walking over your head. That is one permissive parenting. The second one is authoritative parenting, where you say no for everything without reasoning. And I think the most practical approach for parenting is you be assertive, and you first demonstrate in your own way, so that children will automatically start following. That I remember an incident I would like to tell. My daughter was, I think, she must be about 4 or 5 years, and we were walking through that McDonald's, and she had an ice cream cone in her hand. And a little boy came along, and those sometimes those beggars, those come in the evening, he just came along and he wanted to have a ice cream. And she looked at me and she asked me, "Ki, should we buy him one?" So I said, "There's no need to buy. You had your stomach is full. You had a pretty heavy meal, and top of it, you're having ice cream. So if you're really feeling so bad, why don't you give your ice cream to him?" And then she, without a thought, she handed over ice cream to him. Then my husband just looked at me, and he was a little guilty. So he asked me, "Should we buy her one more ice cream?" So I said, "No need, because if we buy her another ice cream, I feel the whole purpose of giving is gone." I basically feel that it's no big deal if you have extra and if you give. If you
Mm.
take out of your proportion, that is, you are teaching. And she was
Oh,
very happy. The guy, the child merrily was licking his ice cream, and he went running away. And she was also very happy and contented. So I think that, and I told her, no problem. Whenever next time we go, we'll buy you an ice cream. So I think that is what speaks more volumes than if you tell your children, "Nahi, you should be doing this, you should be giving them that." That is why. And basically feel academic grades, if you're a very good academician and if you're not a good human being, it doesn't make sense.
mm.
Instead, I should be your, even if you have enough so grades, and if you're an excellent human being, a very warm, kind hearted person, that will definitely take you places, and you will be at peace with yourself,
Mm. Mm.
more importantly.
with teenagers, I remember when I was having this conversation with Vaijayanti Bose, one of the first interviews that I
Mm-hmm.
had.
Yeah.
She's the teenage coach for
Yes.
teenagers.
Yes. Mm-hmm.
We were talking about how, when this particular age, the teenage hormones and puberty, and at the same time, the mother is going through menopause, so they're in
Ask
this
me.
hormonal. So how do you, as a,
I
like,
have a 16-year-old rebel at home.
and kids like to rebel, they don't like rules. So,
No, no, no. They don't like rules.
how do you manage this uh, transition? I suppose for both, in the sense that the teenagers don't really understand because they
Correct.
have not
Yeah, they
experienced
have a lot
anything
of
of the
raging
world.
hormones, and yeah,
And we as
and we also,
menopausal
we
women,
also don't understand
we
sometimes.
don't we don't know that it's going to hit us. We don't know that it's going to
Yes,
hit us. But we
yes,
have some experience of kind of disharmony within, with
yeah.
so many years of going through it. So how do you manage it yourself? How do you coach and counsel parents who come to you with these concerns about their teenagers?
No, I think basically, see, the problem is the usually whenever there is an adolescent at home, so maybe around 10 to 16 years, the mother is in her perimenopausal or menopausal stage. So these, it's a very deadly combination.
Yes.
And yeah, it's very, so I am talking from my personal experience. So most of the times when my husband comes home, he can hear just firecrackers going on most of the time. So he knows me and my daughter are alone at home. But over the years I have learned, because initially it was very difficult for me, because when they were 10 and 11 and 12, they are very rebellious sometimes. After them, sometimes they tone down a little bit, and each child is different. Like there is a lot of difference in between my two kids also. So basically is as I said, you become an assertive parent. Sometimes you have to set boundaries. You have to give them freedom, but it comes with boundaries. As I always tell my parents also, the children also, I always tell, I said, you want freedom, you will get the freedom, but freedom and responsibility are just two sides of the same coin. So
Yes.
if they're going to give you freedom, they are going to give you freedom with some amount of boundaries, which are going to be set by them. You will have to follow, and you have to act responsibly. As I tell my children, till you are 18 years and till you are staying in this house, some rules do apply, and that there is no second thought about that. So there are some rules which can never be broken, some rules which maybe can be twisted a little bit, and for sometimes you give them total freedom on whatever you want. Because
Yes.
I have learned that over a period of time, because I used to say simple things like should I wear this or should I do this, and I say don't. So then she knows ki abhi she has said no, so I have to do that. So after some years, I learned. Now I tell her, you do whatever you want to do. Then she's full day behind me. No, no, you tell me, you give me some idea at least. So you give them when harmless things, you can give them freedom. But some things like traveling alone, or even if they're taking their phones, now they have an Android, or now they have smartphones. So you have to pick up. I'm going to give you a phone, but you have to pick up my call each and every time, or
Hmm.
your phones cannot be locked. I'll tell you a recent incident. I had a patient. She had come to me with a head injury, and then she was bedridden for quite some time, and then she developed PCOS, and that is how she landed it up with me. But a very sad incident. There were four or five of them traveling in a car. They had the yeah adolescent, the college going children. They were giving some exam and coming back, and their car met with a very bad accident, and it was a whole head-on collision with a truck. Two of them had fainted, and two these were severely injured. The other two, and all of their cell phones were locked.
Oh,
So the
no.
police, even if they went there, they couldn't get in touch with anybody. So then they had to go to their institute, they had to talk to the security, reopen the office, check their iCards, check their phone numbers, and then call up
Oh
their
my
house.
God.
So in the meantime, one child was lost on the way. So he expired. So these things can really happen. So I told my children about this incident. Why we are telling not to lock
Oh,
your phones? Because tomorrow, if there's some medical emergency and somebody else has to call for you from your phone has to be unlocked. So then
Mm-hmm.
they understood. But so these are basic things. So whenever we handed them a smartphone, I told them, you are going to get a phone provided this phone will be unlocked. And I will be able to, I will not check, but I should be able to open your phone and look into anything if I want to. So then these guidelines have to be set. And I think this every parent has their own set of boundaries. You can set them. But while giving these things to the children, you have to lay down certain guidelines. Like as if you're using your laptop, you use it in the living room, nowhere else. So these are how you deal with it. It is a definitely. See, I think new age parenting is one of the most difficult tasks to do,
Yes,
because
yes.
our parents, they didn't have this problem. So, but we were born in this, and like, so we
Our
have
parents were
learned
not
technology.
autocratic. I tell
Yes,
you,
and
you have to do this.
no, and our children were born with the phone in their hand. So
Yes,
most of the time, we are technologically quite handicapped than them. So
compared to
most of
them.
the
Yes.
times, if I can't work out my laptop or my phone, I have to call them for help. And they tell कि ये पता नहीं डॉक्टर कैसे बन गई इसको ये नहीं आ रहा है तो so then I tell them, no, you were born with a phone in your hand. ये मैंने अभी सीखा है last 10 years.
Yeah,
Okay.
I had somebody recently on social media tell me, "Oh, you can't figure it out. Go get your kids to do it for you." I was like, "I'm not. I don't have kids." Oh, then you ask your husband. I said, "I'm not married." Why? Somebody who looks like you ought to be married with kids. And I was like, "My God, I thought we got out of that,
Yeah.
but it's still
No, no,
happening."
it's still there.
One thing I wanted to ask you was you wrote a really beautiful article about how a dad's view of coaching his teenage son about adolescent sexuality. So, what is your view about the husbands or the partners, the dads coming in, with this whole thing about menopause? Most of the time, men check out when they find a wife who is
Yes,
kind of become
yes.
moody and
Then
angry and
at that
grumpy. They disappear.
at that time, those are your kids,
Yeah, yeah, yeah.
and he will just walk away. So no, basically because there were lots of articles about how we should talk to our daughters regarding menstrual hygiene, and there are a lot of, you will get a lot of information everywhere. So
Hmm.
I had a lot of requests from my friends, my patients, saying that, Madam, can you write something about how
Boy.
how a dad should talk to his boy. So I thought it was very difficult for me to imagine everything and writing. It was actually a very challenging task to do. But then I've tried to write it from a dad's perspective. The whole write up is there on my Facebook page. But in that, I'll just to brief you about that. I'll tell that it is basically how the dad can pitch in. If you have young boys at home, what happens most of the time, mothers are not comfortable. If especially this happened with me actually. I have been brought up with two sisters. We hardly
Hmm.
had any males in. Apart from my dad, we had no males in our families. So
Hmm.
I don't even have a cousin brother, or I just have one cousin brother who stays out of the continent.
Hmm.
So we never grew up with boys. So it was very difficult for even me to ice break that session with my son or start talking. So
Hmm.
I think here dads play quite an important role. They can talk to them about, and they can basically start at very, very young, or when they are just about to break a mustache or a
Hmm.
beard or something. And then I have written in that they can start talking about them. First they can talk about hygiene, then they can talk about masturbation. They have to tell them that it's a very, very natural thing. And because what happens, boys do masturbate, and
Hmm.
then they end up with that guilt.
Yes.
So that guilt should not be there. And
Yes.
what happens, even mothers don't know about it. So whenever their boys are in the bathroom, then mothers tend to get very aggressive outside the bathroom. They'll start hitting, what are you doing, come on, come on. And I have seen, because then they finish off fast, and this can lead to premature ejaculation later on,
Yes. You
because
get
we
what you
have
practice.
not given them
Yeah.
enough. Correct. So
What you practice.
this problem has to be done. By the time we see them with that problem, it is too late for us to do anything. So
So they
why not
practice and practice.
start them very early. You can tell them about the bad effects of smoking, because in our society these problems are not discussed somehow, I have
Hmm.
seen.
Hmm.
And they feel we have that big thing in our head that if we tell them aisa to nahi hai, we are giving them some extra information.
Hmm. Hmm.
So even if you don't get them, they will get it from outside. They will definitely get it. So it is better that you give it to them. So because you are the person whom they trust the most, and you
Hmm.
are going to give them authentic information. If you can't do it, either mothers also can talk to their sons about this. If they can't do it, if fathers also can't do it, then I said is take professional help.
Mhm.
There are
You were going to
pediatricians who can do
also
it.
mention about the role of fathers in demonstrating to their sons how women should be treated, because that's a huge issue in our society today.
Yes, yes, yes. That is very important because as we see, as children are going to learn from what they see.
Yes.
If you tell them 10 things and you don't do it yourself, children are never, children are very smart. So they know what to learn and what to not. So if they start, best thing a dad can do to his children is, I think, love their mother, respect their mother.
Hmm.
That is very important because as if you have, I've seen in cases of domestic violence, if you are violent or if you are hitting your wife, you are passing a message to your son that it is okay to do so.
Hmm.
Inadvertently he will learn that, and he will think it is okay, and women are meant to be looked down upon, or women are meant to be overpowered.
Hmm.
And so you are giving them a message. If you have a girl child, she will think tomorrow if her husband hits her, she will think it is okay, my dad used to do the same thing, so it is nothing abnormal.
So
So
just
so somehow you are
propagating.
passing this message to her, and she will not find anything wrong, and then she will never tell anything, she will never get help. So I think that is the best way. What you can do is show in your actions, demonstrate rather than tell them. So if you say, what happens, children are very clever. If a mother says no to something, they will go and ask the father. Now what
Hmm.
happens if the father overrides the mother this time? If the
Hmm.
mother has said no and the father said nahi, okay, you can do that, children know that he is the, it's like high court and supreme court. You
Yeah.
go to high court, high court says no, you go to supreme court.
Yeah.
But I think in a family, as a mother and as a father, both should be Supreme Court. There
Yes.
should be no, or even if you don't agree with what your wife is saying, you should tell your children, nahi, your mother has said this, so it is in the interest of him, and I stick to her. So basically, you should be at par on one decision, and
Hmm.
then children, it's very easy to inculcate such habits in children. Then,
Yes. Yes.
otherwise, children they just keep on playing games. They know where to take the benefit from. So that is important, I guess.
Because I know a lot of husbands have to, they shy away from this task. They leave all the difficult conversations, all the, disciplining, all the kind of stuff that makes somebody bad is often left to the mother.
Yes, yes. So
And the
as
good
I
stuff
say, most of the
of
times the
awards
moms
and
are the villains
parties.
of the family. So most of
Yes.
the times, as I say, moms are the villains of the family.
Yeah. I suppose
Most
it
of the
does
time.
apparently.
Yeah.
So I wanted to talk a little bit about sexually transmitted infections because they have very severe consequences for the future life of teenagers. I said we were going to talk about it a little bit later. So I just want to broach that topic now because we've kind of warmed up the topic about sexual health, and we've introduced the topic to the parents as well as the teenagers. And we talked about how sexual debut is happening earlier and earlier, and the kind of information that kids are getting from the internet or from their peers. Um, they don't get taught about. Maybe teenagers understand about condoms and they understand about not getting pregnant, but they don't understand much about sexually transmitted
Yes,
infections.
yes,
Can
yes,
you talk a little bit for the benefit of the audience about what are the long-term consequences of this kind of sexual behavior, which is promiscuous, which is unprotected,
yes.
which is done without knowledge, and what kind of long consequences it can have as a gynecologist, when you're seeing in your practice?
Yeah, what I would like to say that the sexual debut is definitely being is very early nowadays, maybe at 17, 19, 20. And more important than that, they have multiple sexual partners. Now,
Wow.
even if, yeah, because, and it's actually, it's like a web. So if you have one partner, even if you are loyal or with that only one single partner, and even if he has been with another one or two girls, and if that girl is with one or two boys,
Hmm,
if that boy has ever gone to one prostitute, so it's like that web. So that
Yes.
viruses, those viruses, they are all circulating, and this leads to a lot of sexually transmitted disease. Now, what our generation or what this young generation understands is condoms are only to protect pregnancy. So
Hmm.
they need to be told that if you are engaging in sexual activity, you have to use condoms each and every time, not for the fear of pregnant only pregnancy, but also for fear of sexually transmitted diseases, because condom is one method which will definitely protect from sexually transmitted disease. Another thing which I would like to add is, now you have the fad of the menstrual cup.
Hmm.
So this was not there actually, Nilima, when we were doing our MD. This was
Hmm.
not there. So this has come now. So in the last 2 or 3 years, I also get a lot of women who come to me asking if their daughter can use the cup. Maybe 10 years, 12 years. So at
Wow.
that time, I categorically say no. I said 12 and 13 is too young to introduce a silicone foreign object in the vagina. One, that the hymen will be ruptured. Then hymen is there to protect the vagina from getting infections from outside to inside. Secondly, is these girls are too young to introduce the cup. There might be certain accidents, then the cup may get dislodged. She might not be able to remove it. I have had a few cases of stuck up cups coming at right at 1 o'clock and 2 o'clock in the night, where we have to rush in an emergency and take out the cup under general anesthesia. So that is also there. Another thing, what I would like is, we don't have enough data, but this cup, if it is causing pelvic infection, if not used properly, or if retained for a longer time, and if it is causing pelvic infection, we don't know yet because it is new, then it can, over a period of time, it can lead to problems later on in life, like infertility or
Hmm.
because of pelvic infections. So we don't know, but that only time will tell. But if these girls do land up into pelvic infections and infertility, then it is too late to do anything. So ideally is, basically, take professional help if you want, or take consultation. Don't just because your friend is using or somebody else is using, you should use those. That is one thing. Sexually, STDs are definitely on the rise. We have a lot of genital herpes. We still have genital tuberculosis. We think we don't have cases, but we have genital tuberculosis even in the affluent class. So these infections are definitely there. We have a lot of chlamydia,
Yes.
which can definitely cause infertility.
Gonorrhea is going up now.
Gonorrhea is going up. And this
And
is basically
people,
because of
people have kind of
promiscuity.
lost the fear of HIV/AIDS. They've lost the fear of
Yes.
hepatitis. They don't actually even know that you can get hepatitis B from sexual activity.
Yeah. And
I
they
know a
don't
lot
even
of
know about
teenagers.
sexually transmitted diseases. Like, they
No,
don't know what repercussions it can have in later life.
they don't understand that oral sexually transfer. You can get sexually transmitted infections with oral sex as well. They don't
Yes.
understand the need
So
to use
as
condoms.
I said previously, they are aware, but they don't know the true facts.
Yes,
They're only aware, but
yes,
they actually don't know. There are a lot of myths also. So
mm,
there is a certain community, or there are some girls who engage in anal intercourse just to protect their virginity. So
virgin.
this issue also has to be addressed. And
Yes,
unless we talk with them, it is not going to happen. It is not
no,
going to just happen without doing anything. So
yes,
we
yes,
have to proactively do something about it. And
yes,
unless we actually break the barrier and we start talking, we are not going to make them
yes,
talk.
yes.
So we
I
have
do.
to approach them and talk.
I do hope that this session has encouraged parents to open up with their kids, and if they have any doubt about whether they can talk about these topics, they can, bring their kids to you or to gynecologists near them and help them to open up the topic and talk candidly with their kids about these issues. Shalaka, before we close, can you just tell the audience a little bit about the cervical cancer vaccine? Because human
Yes.
papilloma virus is also sexually
Yeah.
transmitted.
Yeah.
And there are a lot of myths and misunderstandings amongst mothers about whether their daughter should get a vaccine or not. And I fear that this vaccine, this whole thing about anti-vaxxing has again spiked up since COVID has come around and
Correct.
COVID
Correct.
vaccination and all.
Yes.
Can you
Yes.
talk a
Yes.
little bit about
Yeah.
the cervical
See,
cancer?
actually, I personally feel the cervical cancer vaccine is a medical breakthrough, because till today, no vaccine is available against any cancer except cervical cancer, which is one of the most important and the most common cancers in women still today.
Yes.
So this is basically cervical cancer is caused by the human papilloma virus, and this vaccine is an antiviral. So that is how it acts. Now the government has recommended 3 doses to young girls. It is most effective if it is taken before the sexual debut.
Hmm.
So whenever I tell my patients that if you have a girl of 17 or 18, give her the vaccine, they say their first reaction is no, still there is time. See, but we need to understand, or we need to tell them that this cervical cancer can be caused by close skin to skin contact also, and that is
Yes.
why IMA has put down now guidelines saying if you give it less than when the girl is less than 15 years of age, you just give 2 doses 6 months
Mm-hmm.
apart, and if she's above 15, you give her the full adult doses, which has 3 doses. And the vaccine is a killed virus. It has absolutely no side effects. It is very safe. And if one shot is going to prevent your daughter from a cervical cancer, it is definitely it. Everybody under the sun has to take it.
Yes.
India, we still are giving only females. Outside, they have started giving them to, I think, males
Men
also,
are, men are the
because
ones who
their
carry from one
pro,
female to the next.
homosexuality is very common there.
Excellent. So,
Okay, I think we have covered
um,
most of the topics.
yes, yes. How can people get in touch with you? How can they read your blogs, your articles? Can you share some of
Yeah,
your social?
I'll be writing. They can. I'll be given my phone number for appointments, and I have also a Facebook page. I'll be
I'll put that
passing
in
the
the
link
chat.
in the comment section. Then you can just look out to my page. It's a public open page, and you can go through my articles, and do let me know also if your feedback. So I'll be glad to
What's
if you
your
want
Facebook
any
page
topics.
called? What's your first Facebook page called?
It's Doc Shashi Shares.
Doc Shashi
DOCSHASI Shares.
Share.
Shares.com. Yeah,
Okay,
shares.
lovely, lovely. Great. Thank you so much. Any last
Yeah.
tips? Any last tips that you want to share before we
Uh,
close?
yeah, what I would like to say, this is for parents and for the children who are listening. Both is, I think, is just as I stressed upon that point, that give freedom to your children with certain boundaries, but then also with the freedom, the children have to act as with responsibility. That is, I think, very important, and that
Yes,
will take a long way.
yes.
Okay,
Thank you so
thank
much,
you. Nice having you.
everyone, for coming, and do share this video. Share it with your husbands, your partners, your boys, kids, the men in your lives. Share it with your children, adolescent children, and enjoy and get in touch with Shalaka if you'd like more information. And do read her articles; they're absolutely amazing. Thank you so much, Shalaka.
Thank you, Nilima. Thank you a lot. Thank
Bye
you all.
bye.
Bye bye. Yeah, bye.